welcome. Today, we're going to dig into something that might just be the hidden cause behind some of that discomfort you've been feeling. We're talking about a hiatal hernia. So let's jump right in and figure out what this is all about. You know that burning feeling you get in your chest sometimes? We've all been there. But what if that nagging, constant heartburn, or that weird sensation that food is getting stuck, what if that's not just simple indigestion? What if it's actually a clue that something, more structural is going on inside your body? So to answer that, we've got to figure out what we're even talking about. Let's unmask the culprit here. What is a hiatal hernia anyway? Okay, let's make this super simple with an analogy. I want you to imagine your diaphragm, that big muscle that helps you breathe. Imagine it's like a floor between your chest and your belly. A hiatal hernia? Well, that's basically when your stomach pushes up through a little opening in that floor. That's it. That's the core idea. So that's the simple version. Now for the slightly more official one. That little opening in your diaphragm, it's called the hiatus. So a hiatal hernia happens when the top part of your stomach actually bulges through that opening and moves up into your chest. And you might be wondering, how does that even happen? Well, it's often caused by increased pressure in your abdomen. Think about things like a chronic cough, straining a lot, or even obesity. Plus, as we get older, changes in the diaphragm can make it easier for this to happen. It's really just a mechanical problem, but boy, can it lead to a whole bunch of issues. All right, so now we know what it is, but the big question is, how would you even know if you have one? So let's play detective and look at some of the common clues and warning signs. And here's the first clue, which is kind of weird. The most common clue might be no clue at all. Seriously, this is a really important point. If the hernia is small, you might not feel anything. It's actually super common for people to be walking around with one and have absolutely no idea. But for people who do have symptoms, the number one culprit is usually heartburn. You know that feeling, that burning sensation right in your chest. And it makes sense, right? Since the stomach has pushed its way upward, that little muscular valve that's supposed to keep acid down in the stomach just doesn't work as well. And that allows acid to splash back up where it doesn't belong. And that leads us right to the next clue, regurgitation. This is basically the backflow of stomach acid or even food into your mouth. The hernia literally weakens or pushes that muscle, the esophageal sphincter, out of place. And when that little gatekeeper isn't where it's supposed to be, it lets stuff travel back up. Another really common one is having trouble swallowing. The technical term is dysphagia. Now, this one isn't about acid at all. It's all about pressure. That piece of your stomach that's now up in your chest can literally put a squeeze on your esophagus. And that's what creates that awful feeling like food is getting stuck halfway down. And there are a few other clues to look out for. Things like bad breath, which comes from that same stomach acid. A lot of belching or hiccuping, especially after you eat. And even a nagging dry cough, because that acid is irritating your throat. But listen up, because this next one is really important. Chest pain. We're not just talking about heartburn here. It can be a serious burning or squeezing feeling. So intense, in fact, that it can sometimes be mistaken for a heart attack. Okay, so you're probably thinking, got it. Stomach pushes up, causes problems. But hold on, because here comes the plot twist. It turns out there isn't just one kind of hiatal hernia. There are actually two different types, and they come with very, very different dangers. Now, the vast majority, we're talking like 95% of cases, are all one type. I want you to lock that number in your head, 95%, because it really puts a spotlight on just how different and potentially way more serious that other 5% can be. And here's where we break it down. On one side, you've got the sliding hernia. That's the 95%er. It's where the top of the stomach just kind of slides up into the chest and often slides back down. This is the one that usually causes all those classic heartburn and reflux symptoms. But then you have the paraesophageal hernia. This one is much rarer and honestly a lot more serious. With this one, a part of the stomach actually gets squeezed up next to the esophagus and stays there. It's essentially trapped, and that can lead to some really big problems. And that second type, the rarer one, comes with a totally different and scarier set of symptoms. Because a bigger chunk of the stomach can get pushed up there, it can actually start squishing your lungs, making it hard to breathe. It can put pressure on your heart or on a major nerve called the vagus nerve, which can make your heart race. And the chest pain, we're talking severe, getting worse by the minute chest pain that is not just heartburn. Which brings us to probably the most important part of this whole conversation, how to know when these symptoms go from being just a nuisance to being a real life-threatening emergency. So what are the absolute red flags? What are the signs that should make you stop everything, stop guessing, and get to a doctor or an ER immediately? Okay, I really need you to pay attention to this list. If you are having severe chest pain or you can't breathe, do not wait. If you're vomiting blood or have bloody stools, if you suddenly can't pass gas or have a bowel movement, or if your heart is just racing and won't calm down, these are all signs that something is seriously wrong and you need medical help right now. And just to drive this point home, check out this quote from one of our sources. It says, an untreated hiatal hernia can lead to strangulation or obstruction. Now, what does that mean? It means the blood supply to that trapped part of the stomach gets completely cut off. That is a massive medical emergency, and it means you need surgery, like, right away. So let's wrap this up with a final question for you. If any of this sounds familiar, that constant heartburn, the food coming back up, the trouble swallowing, maybe, just maybe, it isn't just indigestion. Understanding what a hiatal hernia is and what to look for, well, that's the first step. The next and most important step is up to you, deciding if it's time to talk to your doctor.